And today, Wisconsin reported nearly 3,000 more new cases of COVID-19. It's the second highest number since the pandemic began, trailing only yesterday's record. And since Wisconsin's first COVID case on February 5th, almost 8,200 people in all have been hospitalized statewide, and there have been 1,440 coronavirus deaths in Wisconsin. The latest update from the Wisconsin Hospital Association is that ICUs in Northeast Wisconsin are at 91% capacity. In the Fox Valley, they break out these regions. They're at 86% of capacity. Both numbers are down from earlier this week. NBC 26's Eric Kress talked with a doctor from Aurora Baycare.
The Wisconsin Hospital Association reports there are currently 907 people hospitalized with COVID-19 across the state, a huge spike from just a month ago.
On September 7th, there were 289 patients hospitalized with COVID-19 in Wisconsin. In just 1 month, that number has nearly tripled.
The spread of COVID-19 in Northeast Wisconsin, according to doctors, is a major part of the need for more hospital beds. Many hospitals from the Fox Valley to Green Bay are on the verge of capacity limits, but surprisingly not just for COVID, but other medical issues as well.
It does seem like we're seeing, at this time at least, less of a percentage of ICU sick COVID-19 patients as compared to earlier on in the pandemic.
Dr. Brian Johnson with the Aurora Baycare Medical Center says his staff is preparing for the continued surge of patients by bringing in nursing staff from Milwaukee and Illinois.
This might sound odd, but honestly, I'm happy we didn't have this level of surge back very early on in March and April when we were just putting our surge plans together, because I feel like we wouldn't be nearly as prepared as we are now.
Aurora leaders say they are prepared to handle more patients, though, and they are discovering that by offering care earlier rather than later, they can have better outcomes.
I do feel like we do have better treatment that does help alleviate symptoms and shorten length of stay.
For now, though, Dr. Johnson can't pinpoint why Northeast Wisconsin residents are contracting the virus at such a rapid rate.
I really don't know why we are surging more.
But he does point out that the message of hand washing, social distancing, avoiding crowds, and mask wearing, for now, appears to be our best line of defense. In Northeast Wisconsin, Eric Kress, NBC 26.